Hello everyone. So today we will discuss about the C-section. A cesarean section or a C-section is a surgical procedure used to deliver a baby through an incision in mother's abdomen and uterus when a normal delivery is not possible due to XYZ reasons. It can be categorized into two types: emergency cesarean section and elective cesarean section. An emergency C-section is performed when a sudden and urgent need arises during labor to ensure safety of a mother and baby. Some of the reasons are fetal distress, prolapsed umbilical cord, placental abruption, etc. An elective cesarean section is planned in advance and is not due to any immediate medical emergency. Some of the reasons for choosing an elective C-section include previous cesarean section, breech presentation, multiple pregnancies, and it can be patient's choice. Now let's talk about the incisions or cuts. C-section can involve different type of incisions on abdomen and uterus which can impact recovery and future pregnancies. There are main two type of incisions or cuts used. First one is vertical incision, or we can say longitudinal cut, which is called classical incision or lower vertical incision. Second one is horizontal incision or bikini line cut. Now let's compare both of these. Vertical incision has a longer recovery time as compared to the horizontal incision, which generally leads to quicker and less painful recovery. In vertical incision, there is great chance of developing scar tissue which can affect future pregnancies. But in horizontal incision, there is reduced risk of infection and less scar tissue formation. Nowadays, horizontal incision is done as it affects the lower segment of uterus, which has less blood supply and tends to heal better, and the scar is less visible. In past, vertical C-sections were more common, and these incisions often led to more significant complications and longer recovery times. Older generations may have a lingering belief that this type of incision is still used, leading them to believe that this C-section is more serious and problematic. There may be lack of updated knowledge about modern medical procedures. Many older individuals might not be aware of advancement in C-section techniques and advantages of lower transverse incisions used today. There can be misconceptions about the impact of C-section on women's health and future ability to have more children. The belief that C-section lead to longer health issues or more difficult recovery might be based on past experiences and not reflect current practices. So, education can help shift perceptions and reduce unnecessary pity or stigma.